welcome to Hands on Health. I am Dr. Patrick Frain.
And I'm Dr. Susan Frain.
And welcome to another great episode that we have for you. Not that they're all not great, but
They're all great.
they're all great. But this one is a little bit one that's going to be a little bit more of a close to home kind of story for everybody that's watching.
Absolutely.
And it's the first time we've kind of done one of these, about our lives kind of ones, I will say.
You're right. I'm trying to think if we've done any.
Yeah. This one's a little bit, now I got you intrigued. You're like, what is it? What is it?
Oh, they're going to be personal.
It's a close to home one
Sharing
because Susan is going to share her story with us because today's topic is all about headaches.
Yes.
And this is something that affects a lot of people, but a lot of people is a lot of people, and she's my wife, and it's a really important topic because it's really a big deal. So I don't want to steal any thunder of the story.
There's no thunder being stolen.
So we're going to start with your story. Why don't you tell us a little bit about why headaches is such an important topic to you?
Yeah, well, this is something that I dealt with quite a lot back in college.
Mm-hmm.
So you may know, they might not know. I may be a little bit of a type A personality. I'm not sure if you've...
Oh my God. I'm
shocked.
I'm shocked to hear
down.
this.
I know. It's a shock after like 30 years we've been together, but it is true. Mm-hmm. I am a little bit of a type A personality. So perfection is something that I strive for quite continuously ever since the day I was like born or something. So it's something that's been in my DNA, and in college that strive for perfection led to a lot of stress. Mm-hmm. And led to headaches. Headaches became more chronic, and they led to migraines, which would knock me on my butt for about 24 to 48 hours.
Missing classes.
Missing classes. I was missing work. Okay, so here's how type A I was. I can't remember when this was. I think it started sophomore year. I worked overnights at the hospital.
Right.
And how brilliant is this? I decided it would be smart that after working overnights in an ER for 8 hours, I would go straight to organic chemistry.
Absolutely.
Brilliant, right? Like the hardest class you take as a pre-med, pre-chiropractic student, then it would be organic chemistry lab. So I would like go 24 hours without sleeping.
I would be there with her. We were both not sleeping.
So what the heck? Exactly. You were right there with me. Well, different hospitals, but whatever, it doesn't matter. So you were right there with me. So anyway, big surprise, I would develop headaches, but they kept getting worse and worse and worse, and now it was knocking me on my butt. So I had to figure out what the heck was causing these headaches because I'm downing Advil like crazy. It's getting to the point it's not helping anymore. I've tried everything over the counter you can imagine, and it's not working. And I'm like, oh, I work with a bunch of doctors. So I sat down with them. It'd be like 2 a.m. and you're sitting down, and there's a lull in the patients, and so you're sitting down and I start asking, and they're like, well,
picking their brains.
Why the heck not? I've got free advice sitting here. So we did MRI, we did CAT scan, we did EEG, we did blood work, you name it. Everything came back normal. Most people would be like, well, aren't you relieved? Well, no, because it got to the point where I was like, okay, if all of that is normal, then what the heck is going on?
Then what is it?
Yes, I saw my family practice doctor, I saw neurologists, all that stuff. All they kept doing was putting me on more and more potent drugs. I would take those drugs and it would literally knock me out. I'd be passed out. And well, now I'm still missing school. I don't have a headache, but I'm still missing school.
Yeah, because you're exhausted from the medication.
Yeah, and you're not supposed to work with that medication anyway.
Or operate heavy machinery.
Or operate on a patient, which I wasn't doing.
Which she wasn't doing.
However, you shouldn't do that. So finally, the last straw, I went to the neurologist again, and I said, this is just not working for me. The drugs are working, it's knocking me out, but I can't live like this. And he said, well, maybe you should see a psychiatrist.
It's all in your head.
It's all in your head.
The pounding, throbbing.
Oh my God.
I can't have a light on in the room is all in your head.
I was furious. I was not making these headaches up. They weren't just, a figment of my imagination. I was like, that's it. I'm done. I got to try something different. So working ER one night, overnight, and we have this trauma come in, and I'm helping the x-ray tech who comes in, and he comes in and he says, hey, what's going on? The patient is unconscious, and so you're just chit-chatting. He's like, hey, what's up with you? And I tell him about my headaches. He's like, have you ever tried chiropractic? Why the heck would I try chiropractic?
What is that?
What is that?
That's for my back.
Back pain, right?
That's for my back.
He's like, no, you should try it. So anyway, went ahead and tried it and went to a chiropractor. I found someone that actually my cousin was going to. And he does all of these different scans and stuff, different from what I had gotten before. He throws up these x-rays. He said, I found the cause of your problem and I can help you.
That's big news.
Holy
That's big
crap.
news.
I was like, you've got to be kidding me. So he shows me what the problem was. And sure enough, within weeks, my headaches start to decrease. The migraines go away. Next thing I know, I'm like, I need more of that. What the heck is happening here?
Yep.
And 20, 30, how many years? It's been a long time.
20,
now I'm a chiropractor.
25 years from the start of
Holy crap.
chiropractic school to now.
Yeah.
But that's
And
why
here
this
we are.
that's why this story is so near and dear, because
Yeah.
I knew her win, and what she's explained to you is exactly right. That's how it was. And when you care about somebody, you don't want to see them in pain or discomfort, right? I mean, if you're listening to this and your spouse is dealing with this or a significant other is dealing with this, you don't want that for
Right.
that person.
Even kids nowadays.
Even kids,
dealing
right?
with this,
Well,
yeah.
a lot of kids, that's a whole other
Yeah,
thing. But
well.
the fact of the matter is, though, that look at what she explained to you. How much is that your case? How much is that your situation that you've tried everything?
Yes.
And unfortunately, but fortunately, chiropractic care was like the last thing. Nobody
Right.
brings it up because no one understands that that's something that can be beneficial, and sometimes it's even really the only thing that works for
Yes.
people. And it's one of the big feathers in the cap for the chiropractic profession, is it's really been a landmark for the whole profession. If we're going to get pigeonholed into one thing, it's been one of those things, but there's an awful lot of people that come in and it just helps them deal with their conditions just like it did.
Well,
like
because
did
it
with
gets
you.
to the cause of the problem. And that's what we always talk about on these podcasts. What is the cause of the problem, and then address that. Just masking the symptoms isn't helping
Correct.
anybody.
Correct. And the masking wasn't even working. It was like masking
Exactly.
tape that was falling off.
Right.
You're putting the tape on and it was peeling right off anyway. So it's not like the masking was even
And my body was
beneficial.
not giving me headaches because it lacked ibuprofen.
The thing that I always go back to on this, though, is that thank God for that x-ray technician.
Right.
Because if he wouldn't have said something, you probably wouldn't have checked it out. And
Right.
I don't know if we would all be here, right? I
Yeah.
mean, when you're looking
amazing,
when you're
yeah.
looking at what kind of a doctor to become, there's so many options that are out there. I don't know if chiropractic care would have been like, knocking us over the heads, but because he said something and you said, boy, that's of interest, I found the family member that's seeing someone, I see that gentleman who did a great job, and the next thing you know, it's launched us into a 25-year profession.
Yeah.
That even I made some decisions to say, boy, I want to look at this because I was looking at some other things. I want to look at this too, and it's been phenomenal
Yeah.
because of something one person said. So as you're listening to this podcast today, if you know someone that is struggling with headaches, please share this podcast with them, direct them to this
Absolutely.
podcast. You could be that x-ray technician for that friend or family member of yours, and you could change their life by getting rid of their headaches because you shared this with them. So
And they'll
please,
thank
please
you a
consider
million
that.
times over.
Yeah, absolutely. Please
Yeah.
consider that. But no podcast would be complete if it wasn't for a special guest appearance by our Bond girl, Stats
Stats
Galore.
Okay. So sadly, I was one of the 45 million Americans that suffer annually with headaches. That is 1 in every 6 people. I think it's actually becoming more because I have parents bringing their kids in now
Yep.
for headaches,
Yeah.
which is absolutely absurd. 7, 8, 9, 10 years old, and these kids are having chronic headaches, and we're going to talk about why.
So let's talk about that. So we do have a lot of headache patients that come in. So what are the most common types of headaches?
So there are several different types of headaches. We're going to talk about the 3 most common. We are not going to talk about the really abnormal stuff like you have a tumor in
Right.
your brain. Okay, it's not a tumor. Right?
Most of the time.
Most of the time, it's not a tumor. Most of the time. So we're going to talk about the 3 most common. So I've got little infograph from Cedars-Sinai Hospital.
Nice.
They do it. Yeah, I
The
know,
fine
right?
people at
It's this-
Cedars-Sinai.
The fine people. The 3 most common types of headache: tension headache.
Okay.
Okay, this is usually a slow onset, dull to moderate pain, usually hurts on both sides of the head, kind of like wraps around. Yeah, it's like you're
Tension.
wearing a headband. It's like the 1980s, and you've got the
The headband.
yeah,
Yeah.
you've got the headband around,
Yep.
and yeah,
Yep,
I'm
with,
picturing
with
you
your
know,
leg
those-
warmers, you got your big hair bands, can of spray nut,
God,
aqua
oh
nut.
dear God, yes.
Okay, but tension is going to be
Tension.
banding.
Yeah, it could be in the back of the head. A lot of people talk about their skull, right at the base of their skull with a headache. So tension type of headache, 90% of headaches are tension headaches. Migraines, throbbing pain, you'll usually have nausea or vomiting. You might have sensitivity to light and sound. These are what I had. Oh my God, horrible.
A lot of people affected.
Yeah, it can last hours to days. You can literally suffer with this for days. Cluster headaches, very sudden onset. Several headaches will occur in a series or in a cluster. Pain on one side, often behind the eye. You'll feel like your eye is ready to explode, and sometimes you wish it would, so you'd feel better. Red, watery eyes. So those are our clusters. So those are our 3 types: tension, migraine, and cluster headaches.
Absolutely. So when we look at this, I know that this is not like all inclusive, but
Right.
there have to be, some natural things, and maybe we're going to get into that.
Yeah,
So,
absolutely.
but before we get to what do, we've got to get to the causes, and this is probably a little bit of a laundry
Yes,
list. So
it
so
is.
what are the causes?
Well, one of
these
the
headaches
things when I have patients come in to my office with headaches and they're like, I got to get rid of these things, one of my first questions is, when was your last eye exam? Because very often it can be that your eyes are having issues.
Sure.
You can't see very well far away. Maybe you're having trouble because you're sitting at a computer day in and day out. So we'll talk about things like getting one of those blue light filters
Yep.
on the computer,
Yep.
stuff like that. Medication. So we talked about this last podcast. You can actually be on a medication that can cause headaches.
Yep.
That could be one of the side effects.
Absolutely, it's a
So
common one.
It's very common. So you go to thedrugs.com, you look up your medication, you see, oh my gosh, it can cause headaches. Maybe that's what I'm experiencing. Stress. Stress is huge, and we're going to go into that a little bit more later. Hormones, we are not getting into right now. However, the giant fluctuation that we can have as women with our hormones can absolutely be a contributing factor.
For sure.
High blood pressure. You have high blood pressure, you could end up with headaches. Need to get that under control. There are things
That's a serious one.
That's a very serious one, and that definitely needs to be under control. You need to be
co-managed.
very
on
much
that
so.
one.
Absolutely. Infections like meningitis, injury to the head, neck, and spine. If you have a concussion, for example, one of the most common symptoms is headache.
And I'm going to go with old injury on that as well. So a lot of
Yes,
times when
correct.
someone says injury, people think, we'll ask somebody, did you do anything? No, I didn't do anything. Well, it's not that the injury happened yesterday.
Correct.
I remember being in high school one time, and I was messing around with my friends, and I was in the physics room, and I was going to jump out into the hallway to shock my friend. And anyways, as I leapt out, I'm a tall guy, and I hit my head on the door frame.
Oh.
Okay. Now that, I probably had a concussion at the time. I'm almost certain I did.
Yeah.
But I didn't get the headaches like that week. The headaches started
Right.
6 months after that. And then I realized that hit on the door frame messed up my neck, created a lot of anterior head carriage, and ultimately, it came from that. So when you're thinking about injuries of the head, neck, spine, it's not just an injury that you had yesterday. It could be an injury that happened decades ago.
That's exactly right. So I talked about my headaches starting in college. When I finally went to the chiropractor and he had taken these x-rays and we talked about it, we actually figured out that my headaches had resulted from an injury I had when I was around 10 or 12. Do you remember those slip and slides?
Yeah, the slip and slides, yeah.
We had one of those stupid things. Well, I went running, and I didn't do this,
You're
right?
a kid,
I'm
yeah.
a kid, I'm
Right.
playing around, I'm having fun, right? I went running, and instead of then, jumping onto the slip and slide,
Like the belly flap?
I kept running on the slip and slide.
yeah.
Well, I went backwards, I whipped my head down and hit it on the ground. Well, I then had a headache.
Yep.
And I remember my folks taking me to the emergency room and getting checked out, and they're like, oh yeah, you're fine. And it did go away. Until about 10 years later. 8
Yeah.
to 10 years later, and then it became a really big issue.
Which is also why it's so important in the health history. When you're working with a patient, if you're seeing someone, they're not taking a good health history, they are missing the boat on your care.
And
you have to have a good health
that's
history.
why kids should be getting checked by their chiropractor regularly.
That's right.
Because something as simple as that, I felt better within like 24 hours.
Well, the symptoms went away,
The symptoms went
but
away.
the problem didn't go away.
Exactly.
That's what it is.
Yes. So arthritis.
Arthritis.
Arthritis is another big thing, particularly arthritis like in our necks, for example, that can then hit on the nerves that go back up into our head. Temperature, like extreme heat or cold, we've heard of heat stroke and things like
Correct.
that. Okay, so that can cause headaches. Loud noises is another really big one.
When I always think to myself, I think back to the late great Dr. Fred Barge, who instructed us in chiropractic school and said that the patient is entitled to have more than one problem.
Yes.
Because what you just told us on that list, you can have, I have that one, I have that one, I have that one. You
Right.
could have multiple things on that list. that have compiled up over your lifetime.
And that's not all inclusive either. You
Right.
could have nutrient deficiencies that cause headaches as well.
So let's talk about, can you whittle this down to like a top 5? Top 5 causes, and then what do we do about it?
Yeah, so the top 5 causes that honestly, when you look at it, can be quite simple to take care of. Number 1 is dehydration. As a country, we suck at keeping ourselves hydrated.
Yep.
We do not drink, and things like, people are like, well, I'm drinking lots of beverages every day. I've got my soda and all that stuff. I've got my coffee, and that doesn't count.
Right, coffee doesn't count. It dehydrates you.
Exactly.
Yep.
If you are drinking things that have caffeine in it, caffeine is a major dehydrator. Sugar is another really big one. So if you're drinking those, special flavored waters and they're full of sugar, that's not helping you either.
That's right.
And go ahead.
Yeah, if you're out cutting the grass, well, no, I was hydrated when I was cutting the grass. I had 3 Pepsis while I was out on the John Deere.
golly.
Well, yeah, but that just dehydrated you.
Right.
It didn't provide hydration. It dehydrated you.
Exactly. And then some other people are like, well, I do, I've got those like 16-ounce bottles and I drink 2 of those a day. 16 ounces, that's 32 ounces of water total. You're thinking, hey, I'm doing great. Not quite.
That didn't cut it.
Because if you look up at WebMD or you do even just a basic Google search, you're going to find that to hydrate yourself properly, you should be drinking 1/2 to 1 full ounce of water per pound of body weight.
Wow.
That's a lot.
That's a lot of water. Yeah, you're going to feel like you're going to float away,
You're
but
gonna
that's
be peeing all day
that's
long.
what it takes.
It's like, yeah. So I tell people, okay, well, that might be a little excessive. So maybe we start at like 64 ounces if you're over 100 pounds or so, and let's go from there. I get a lot of complaints. People like, I don't like the taste of water. And that's okay. I'm not a major fan either. So what I did was I got one of those infuser bottles. Get 2 of those. Get 2 32-ouncers. And you can do cucumber in there. You can do strawberries. There's actually, if you Google it, there is a slew of stuff that you can put in there to really flavor up that water. And make 2 of those at night before you go to bed. Shove them in the refrigerator. When you leave in the morning, grab those 2. And now there's your 64 ounces of water.
It's an easy way to flavor things up from a natural way.
A natural way, exactly.
Yep. Like it.
Next one. So we talked a lot about stress, right?
Yeah, absolutely.
Okay, we started on stress a little bit. So we can try heat because a lot of headaches can be caused by the tension that we have in the, and I'm just like messing with my mic here. I probably just screwed that up for you guys. Sorry about that. But we talk about muscles in our neck and in our shoulders. They get really tight and tense. When we're stressed out, our shoulders are up in our ears. Well, some nice heat can really help relax those muscles.
Yeah, and what happens is when these muscles in the neck, when they tighten up and they constrict like that, it actually vasoconstricts. So it starts choking off the blood supply to the head because the muscles of the neck are there. The heat goes on, the heat is nice, it's soothing, but physiologically it vasodilates and it opens up the blood vessels to promote proper blood flow between the neck and the shoulders and the rest of the body.
It helps to relax those muscles because the muscles also attach to the bones of our spine. And so if those are pulling the bones of the spine out of alignment, well, now you've got a whole different problem that we're going to talk about in a little bit.
Absolutely.
Moist heat is what does the best job with regard to relaxing those muscles because it penetrates deeper. So yes, you can get the job done with a dry heat, but stand in that shower, hot shower for like 15 to 20 minutes, and that's going to do more than the dry heat will.
Yeah, I like getting a hand towel and getting it real nice hot water on there. You could even put the hand towel in the microwave for about a minute and get it all steamy, and then drape that over your shoulders or the back of your neck. It will penetrate deep, and it's wonderful. Great to do in the shower because then you take it, you get heat it up, take it with you to the shower, throw it over. If the water's not running, just let it kind of run down your body. That way you don't have to worry about it getting on the floor.
Exactly.
But it can be very, very therapeutic.
And another thing could be you might need ice. So you might need more of the cold if your headaches are due to inflammation. And often people will ask, well, how do I know? You don't always know. It's kind of a trial and error sometimes. Inflammation, if you had a recent injury, then the cold is probably going to do a better job. So you can try that first. But otherwise, it's kind of you try the cold or you try the heat. And you see what works better for you.
Whatever works best for you, depending on where you're at.
Exactly. Sit up straight. Mom was right. Gosh darn it.
Good
Sit
posture.
Up straight, man. Good posture is terribly important. I see this all the time. So here's the deal. Our head weighs 8 to 10 pounds. Okay? If we are looking down, so I've got my cell phone here, and what do?
Everyone's looking down. Everybody's looking down.
And we are doing this for hours on end. This is probably the main reason why I'm seeing so many kids lately, is they're looking down on these God bless it, cell phones instead of holding it up. So we'll talk to our kids, we yell at our kids all the time, hold your phone up.
Right.
They're tired of hearing about that. But even if you are resting your elbows, putting a pillow on your lap and you've got
kind
it
of doing this.
Yes, hold the phone up. Other things, I'll have new moms in and they'll be talking about nursing their newborn, and I'll talk to them about making sure that you're bringing baby up to you, not you down to baby. You should not be hunched over baby. I know baby is gorgeous and beautiful and you want to look down all the time, but get all of those pillows and bring baby up to you so you can have the good posture.
Absolutely.
Because that's one of the most common things I see in my new moms is they're getting upper back pain and headaches as a result of looking down at that gorgeous kid all day. Pillow. Pillows are huge. That's a long drawn out conversation.
I think that's a separate podcast.
It is,
Yeah.
but the right pillow is very, very important. Is it something I ate?
Could be.
Don't know. Because here's the deal. We might have food intolerances or sensitivities that we know nothing about. We have no idea that we have these, but it's causing us to end up with headaches.
And it's something you're commonly eating every day that you think is good
Right.
for you, but it could be actually
You
giving
have
you the
no
headache.
idea.
Right.
And we talked about that, our first podcast was healing the gut. But things in particular that will usually be a contributing factor to headaches: processed meat, MSG, alcohol, caffeine, artificial sweeteners, and canned foods. Basically,
You
garbage in, garbage out.
You just described the classic American diet right there.
Exactly, that's exactly right.
Wow.
But even if you don't eat all of those things, you may have a sensitivity to a food that is considered healthy that your body just simply doesn't like. That's why we like to do the remedy testing.
The remedy testing is really good for that. That's just a way you can definitively find out, here's what it is,
Exactly.
instead of just randomly guessing, trial and error. You're going to waste years of your life with that.
That's exactly right. And then there is magnesium deficiency. That's a big one. If we have too much calcium, not enough magnesium, our muscles will tense up. That can be an issue. And it could be actually what's called a rebound headache. So Mayo Clinic talks about medication overuse or rebound headaches being caused by regular long-term use of medication that is designed to treat the headaches. So the medication you're taking is treating the headache, but then causing rebound headaches.
So you're getting a different kind of headache than what the medication was treating. So the medication is successful because it's actually working, it's doing what it was intended for, but a side effect is it's giving you a different type of headache called a rebound headache.
Exactly.
Lovely.
Yikes, 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 yikes. And perhaps the most important, most common one that we see is something called a subluxation. It's a big old fancy word, and basically what that is a misalignment in our spine. Usually, I'll see this from the upper back on up. Something in that area is out of alignment, hits on the nerves, those nerves go back up into our head. They also go to the muscles of our neck and our shoulders, and when we have a misalignment and that nerve is getting irritated, we can end up with headaches as a result.
And that goes back to the initial story of when you met the X-ray technician, and he said, hey, you should go look into getting some chiropractic care for this, because it came down to nerve pressure.
Yes.
Because those vertebrae, specifically upper cervical vertebrae, were slightly misaligned. Subluxation.
Slip and slide.
Yeah,
that
like a
darn
little
thing.
subluxation. I always think of like a little dislocation. It's not a dislocation. It's like a little like a submarine.
And
just
it doesn't
under.
take very much.
Right.
There's research out there that has shown that we have just a slight change to our nerve pressure, just 5 millimeters of mercury, which is basically the amount of pressure to check the ripeness of a tomato, is enough to cause problems with that nerve.
Yeah, they're very small amounts.
Exactly.
So this has been great because there has been just a lot of information on this. We certainly heard Dr. Susan's personal story, and I think that's always something good. And we want to share that with you. You come in, you give us all of your health history. There's nothing wrong with us sharing our health history with you as well. Again, this is a topic that if you know someone that could benefit from this, please be that X-ray technician to your family member or your friend. It's so critical because they're trying to get through their day. They're trying to get through their shift,
it's
their life.
hard.
It can affect relationships. You know, I mean, there are people that the spouse might not understand. The spouse is a layperson, doesn't understand healthcare, and they could be always upset with their spouse because, gosh darn it, they got another headache again. You know, they're missing the party again. It's not because they're antisocial and don't want to see your relatives. It's because their head's killing them.
Yeah.
And the children can pick up on this, and it's not a great way to spend life with your kids when you constantly have a headache.
Exactly.
So please turn somebody who needs this information onto this podcast. Subscribe, like, share it for sure. But we learned a lot of things today. I mean, we had a whole bunch of causes. A lot of these things, I think you could have 2 or 3.
Yeah.
We talked about dehydration. We talked about trying heat or ice, the posture things and sitting up straight. Is it something that you ate? Consider a remedy test if you don't know what you're eating is there. That's a huge thing. Consider that. And then looking at those medications, could those even be rebounding the headaches back even though they're being properly
And most
treated?
importantly, have a spinal health checkup because you don't know. You might have a subluxation that's causing your headaches, just like I did. I had no idea.
Yeah, absolutely. We get our eyes checked, we get our teeth checked, and just because we don't see the spine, it's internal, we think, I don't know. Or why would I need my kids? You know, my kids they don't have back pain, they don't have whatever, you know, they don't need to be checked. Yes, they do. Yes, they do, because the problems can be very subtle. A few millimeters can make a huge difference in your health.
Absolutely.
So I appreciate you sharing your story, and I know that the listeners will as well.
Well, thank you.
Very good. Yeah. All right, we hope you've enjoyed this episode. It has been a personal one, and there'll be more of those to come for sure. In the meantime, I am Dr. Patrick Frain.
And I'm Dr. Susan Frain.
Thank you for joining us on Hands On Health, where we bring you all sorts of things wellness-wise. Have a wonderful week. We'll see you on our next episode.